Did you know that many chronic illnesses can be managed more effectively or even reversed when caught early? In today's video, we'll discuss how to identify the early symptoms of common chronic diseases in seniors and how to take action to protect your health. Let's dive into what every senior and their loved ones should be aware when it comes to chronic illnesses. So when you say chronic illnesses, we're talking about health conditions that requires continued medical attention. Heart disease, diabetes, arthritis, autoimmune diseases, dementia, and many more. This can impact anyone. But did you know that the earlier you spot the signs, the better you can manage them? My name is Dr. Adelita James, and your lifestyle and wellness doctor and coach. And I'm here to help you live your best, healthiest life as you age. Today, we're going to explore the early warning signs of these common chronic diseases in seniors. So, as I've mentioned, chronic diseases are long-lasting conditions that typically develop over time. You may not know it, but you're developing the disease, and until the symptoms arise, you didn't know you have that disease. But as we age, the risk of developing these conditions increases. That's the sad part. But the good news is, with early intervention, seniors can live healthier and more fulfilling life. According to the Centers for Disease Control and Prevention, or CDC, 6 in 10 adults in the US have chronic disease, and 4 in 10 adults have 2 or more chronic conditions. That's a staggering statistics. Now, first let's talk about this most common chronic disease, heart disease. What are the early signs of heart disease? Some early signs of heart disease include fatigue, feeling unusually tired or out of breath, especially during activities that were once easy. Now he gets easily fatigued. Number 2, shortness of breath. That's difficulty breathing or shallow breathing during physical activity, or at worst, even at rest. Third symptom of heart disease is chest pain or chest discomfort. That's a feeling of tightness, pressure, or pain in the chest that may come and go. So it's not just pain, but pressure or tightness. Remember those. Now, my tip is, if you have a loved one or you experiences any of these symptoms, don't ignore them. Early detection and lifestyle changes like a heart-healthy diet can help prevent heart disease from advancing. You gotta see your doctor though if you already have any of these symptoms. According to the American Heart Association, maintaining a healthy diet, regular physical activity, and not smoking can help significantly reduce the risk of heart disease. Now let's move on to the second most common chronic disease, diabetes. Early signs of diabetes. Type 2 is the most common type of diabetes, and it can develop over many years without obvious symptoms. And here's what you're going to look for. Increased thirst or frequent urination. This is like a constant feeling of being thirsty and needing to urinate more often. Watch out. That can be a symptom of diabetes. Number 2, or the second symptom, is fatigue. Unusually feeling fatigued or tired or drained of energy, even though you didn't do anything for the day. Third symptom, blurred vision. Diabetes can affect the blood vessels in your eyes, leading to vision changes. Now, here's my tip. If you're experiencing any of these symptoms, it's important to check your blood sugar levels regularly and make dietary changes such as reducing processed sugar and moving away from animal products and meat products. Going towards what? A whole food plant-based diet. But make sure that you go see your doctor and have you check. There's a blood test called A1C test that's more reliable in telling us if you have pre-diabetes or diabetes. According to the American Diabetes Association, maintaining a healthy weight and staying physically active can help prevent or delay the onset of type 2 diabetes. Now, the third chronic disease is arthritis, and these are the early signs of arthritis. Since this affects millions of seniors, catching it early can help manage the pain and prevent further joint damage. So the early signs of arthritis include joint pain, especially after sitting or prolonged sitting, lying down, or for extended period of time. Second symptom, stiffness of the joints. Difficulty moving the joints, especially in the morning. It's just so stiff. Not necessarily painful, but it's stiff. Third symptom, swelling. Noticeable swelling or redness around the joint is a symptom of arthritis. My tip, engage in gentle exercise like swimming or yoga. These can help manage arthritis symptoms, and staying active can actually improve joint mobility. The CDC suggests that physical activity and maintaining a healthy weight can help reduce the pain and inflammation caused by arthritis. Now, let's move on to our fourth common chronic disease, osteoporosis. Early signs of osteoporosis. What is osteoporosis? It's a silent disease that weakens the bones and increases the risk of fractures. Early symptoms can include back pain. That's the pain by a fracture or collapse of a vertebra. If you have or starting to have some back pain, you need to go see a doctor. That back may need to be x-rayed. See if there is a collapse of your vertebral column or some signs of osteoporosis. Another symptom of osteoporosis, stooped posture. A curve or hunched back can develop over time. Third symptom, frequent fractures. Bones breaking, obviously, because they're more easily broken because they are weak. So my tip, ensure that you get enough calcium and vitamin D in your diet to support bone health, and consider weight-bearing exercise. This is one of the most common things that people underestimate when they're doing exercise to strengthen their bone. It has to be a weight-bearing exercise, like walking, right? You're walking to help strengthen the bones. The National Osteoporosis Foundation recommends regular bone density tests for seniors, especially those at risk of fractures. The fifth common disease, chronic disease in seniors, is hypertension or high blood pressure. Hypertension is often called the silent killer, and I do have a video about this, just exclusively about hypertension. The silent killer, because it typically has no symptoms. However, it's important to know these signs. Headaches, especially if they're severe or frequent. You gotta check your blood pressure when you have that symptom. Number 2, dizziness, feeling lightheaded or faint. Number 3, blurred vision or nosebleeds can be symptoms of hypertension. These can sometimes lead to high blood pressure too. So my tip to monitor hypertension, the only way to know is to regularly check your blood pressure. It's very important. Lifestyle changes like reducing your sodium intake and managing stress can help keep your blood pressure in check. How much sodium? I have a separate video about that on how to tell how much salt is in your food. Go check it, okay? Now, according to the American Heart Association, eating a healthy diet, reducing alcohol intake, and exercising regularly can prevent and manage hypertension. The sixth, but not the least common of the chronic disease of elderly or seniors is stroke. A stroke is a medical emergency, but recognizing the symptoms early can save lives. Here are the warning signs to watch for: sudden numbness or weakness, especially on one side of the body. Person should be able to tell you this. Second, confusion, trouble speaking or understanding speech. That can be a stroke. What about vision problems? Sudden trouble seeing in one or both eyes can be a sign of stroke. So my tip, remember the acronym FAST, F-A-S-T. F for face drooping on one side, A for arm weakness, S for speech difficulty, and T for time to call 911. FAST. The National Stroke Association emphasizes that acting fast and seeking medical attention within 3 hours of stroke symptoms can reduce long-term effects. See, chronic diseases can be overwhelming, but knowing the signs, the early signs, allows you to take control of your health and seek timely treatment. By recognizing these symptoms and making lifestyle changes, just the number one medication for chronic disease, lifestyle changes and healthy plant-based diet, they can significantly improve your quality of life. If you or your loved one is experiencing any of these symptoms, I encourage you to speak with your healthcare provider. Early intervention is key to managing chronic illnesses. Thank you all for watching, and don't forget to like, subscribe, and share this video with someone who may find it helpful. Drop a comment below with any questions or personal experiences you'd like to share. I'd love to hear from you. If you want more tips also on staying healthy as you age, don't miss our next video. Remember, knowledge is power. So let's take charge of our health together. Bye for now, and I'll see you next week.